Do people who have anxiety always have sleep issues, or are they always correlated? Is it kind of or is it a larger, a big array of people who, anyone can fall on anywhere on the spectrum?
Yeah, so there is a very strong correlation between anxiety and sleep issues. And I'd have to pull up the statistic now, but I think it's something like almost like up to 80% of people with anxiety struggle with sleep issues at some point. And another really interesting statistic there is that sleep deprivation can induce anxiety. So even if someone doesn't necessarily have an anxiety disorder per se, a sleepless night can increase their levels of anxiety the next day. Furthermore, getting a deep night's sleep can actually reduce a person's anxiety levels the next day. So there is, a pretty strong correlation between the two. And one of the reasons for this is that, sleep is not a passive process. Like we think of it as just kind of falling into the state of oblivion, and then like you're out for 6, 7, 8 hours, and you wake up and you're ready to go the next day.
Sounds like me.
Yeah, right. Yeah, that's good. That's good.
Yeah.
But sleep is very active. So when we go to sleep, the brain goes to work and it starts clearing out toxins that build up during the day. So it sweeps out like proteins like amyloid beta that are implicated in the development of dementia later in life, Alzheimer's dementia. So sleep is a process to actually clear out all of those toxins that build up. During sleep, the blood pressure goes down, so it helps to regulate the cardiovascular system. People with high blood pressure should be checked for sleep apnea, especially if they have treatment-resistant high blood pressure, because that dipping, it's called the dipping of blood pressure at night, is really important for blood pressure regulation during the day. During the sleep, the immune system is regulated, and there's studies showing that when people are sleep deprived, they don't respond to vaccines as readily. And people, might need another dose of a vaccine to get the effects if they're chronically sleep deprived, or if they haven't gotten enough sleep just even a few nights before the vaccine. So that's super important right now, during this pandemic that we're still kind of going through. And then, sleep also helps with repairing muscles and tissues. So for people who are athletes, or if you're exercising, working out, you need that rest so that your body can physically repair itself. And then also during sleep, you consolidate memories. So if you're learning something, whether it's something physical, like learning, you're practicing your tennis swing, or learning how to play golf, or learning how to ride a motorcycle, or if you're learning a new language, or, you're studying for your exam, or whatever, sleep helps you consolidate those physical memories and also the other cognitive memories as well. So there's so many things. I mean, the list goes on. This is just scratching the surface of what happens during sleep, and it's still kind of a mystery. We don't know all the things that happen during sleep, but it's such a fundamental, important process. And this is why I tell people, especially my high performers, my tech executives, that you don't want to skimp on sleep. If you want to be on your A game and you want to perform at your best, you need to make sure you're making sleep a priority.
Yeah, I like the way that you put that it's like you're going to sleep, like you're out, but your body's active, like your brain is, it's like time to go to work, and it's a completely different aspect. But even with like some of my patients who are constantly expressing that they're having pain, that can be a whole nother conversation where we talk about pain and, anxiety and how in sleep and how it contributes to that. But certainly it's an aspect that I try to ask patients as well, is like, are you getting enough sleep? Like that's also a part of training. Like that is like making sure that you're fully recovered to perform at your best when you need it. And that certainly needs to be talked about a lot. But you do say that there's this correlation where 80% of people potentially have sleep issues if they have anxiety. How often is it that you have an individual who, because they're sleep deprived, they have anxiety, versus someone who has anxiety and they have a sleep issue? Like how often are you seeing each of them, and are they often like, how do you just like discriminate between the two? Because both, I'm assuming, need different interventions.
Yeah, that's a really good question. So it's kind of hard to tease out one from the other because they are so intertwined. So I get people who come to me for help with sleep, and they don't identify as having anxiety, right? So they'll say like, oh, I have trouble sleeping. I don't feel rested. I wake up too frequently during the night. Now I always start with a root cause analysis to see, what's going on, to make sure there's not some medical issue that's causing it. But oftentimes what I see is that these people are really struggling with anxiety, right? And then sleep is just, it's like a manifestation of their anxiety. Like I had one patient who came to me and said, I have like a list of like 30 different things that I have to do before I go to bed in order to sleep. I'm like, okay, that sounds very stressful.
Yeah, I'm stressed. Yeah.
Like, okay, if you don't do it all perfectly, you're not gonna be able to sleep. That sounds very like stressful and anxiety provoking to me,
Yeah.
right? So sometimes sleep issues can show up in that way. And conversely, people who are struggling with anxiety, sometimes they can start to develop a fear of sleep because sleep is also a process of letting go. You're vulnerable during sleep. People who have experienced trauma might not experience sleep as a safe space to be. So there's that relationship as well. So this is why cognitive behavioral therapy for insomnia, Cbti, is so effective. And so Cbti is a specific type of therapy. It's different from your regular cognitive behavioral therapy. It's a specific protocol for insomnia. And it's really good at kind of managing that anxiety around sleep. And actually studies show that when people do Cbti, they also experience improvements in their mood, and it can help with reducing symptoms of depression. And it also can prevent the onset of depression, even though it's specifically for sleep.
Does that fall within the category of like integrative psychiatry, or is that in a traditional role as a psychiatrist?
So Cbti is considered a conventional therapy. So it's kind of one of the standard therapies that's used in sleep medicine. A person doing Cbti has to be specifically trained in it. So there's a specific training for cognitive behavioral therapy for insomnia. So usually those are behavioral sleep specialists that do that training. And it's really complementary to an integrative approach. So like for me as an integrative sleep doctor, I like to kind of look under the hood, as I call it, to see, are there micronutrient deficiencies? Are there issues with the microbiome? Are there other mental health, challenges that we need to be addressing? Are there medications that could be causing issues with sleep? And so doing that in conjunction with Cbti can be really, really helpful for people.
And you said medications with sleep. One thing that people have been taking since the dawn for a very long time recently is melatonin. Do you recommend melatonin use? And if so, are there places that you can reliably get it? I know supplement industries aren't always the most reliable in regards to dosage and so on. So what are your thoughts on melatonin?
Yeah, so melatonin, it's super common for people to take it. There was actually a report that came out recently showing that there's a great deal of variability in what's actually in the supplements. Like sometimes it can contain 400 times more than what it says, or way less than what it says.
Right.
So I recommend to people, if you're going to be taking a supplement, whether it's melatonin or something else, to use a professional grade supplement, or at least one that's been third-party tested. So I have a video on my YouTube channel about like what to look for with third-party testing and supplements. So I don't have to go into all detail about all of that, but with melatonin specifically, okay, so melatonin is a hormone. It's produced by the brain. It's produced by the pineal gland in the brain naturally. And it's not a sleep aid, it's a body clock regulator. So it tells our brain and our body when it's time to go to sleep. So it's produced naturally in an environment of darkness. So that's why you want to dim your lights in the evening after sundown to help promote your body's own natural production of melatonin. Now, melatonin supplements can be helpful in certain cases. So it can be helpful for realigning the circadian rhythm or the body clock. So for like teenagers, young adults, or even, older adults who are struggling with a delayed body clock, like if you can't fall asleep till midnight, 1, 2, 3, 4 o'clock in the morning, and then you can't get up before noon, like you're sleeping until 2 p.m., that could be a sign of a delayed body clock. So a little dose of melatonin timed correctly can help pull that body clock earlier. On the flip side, older adults often get what's called advanced sleep phase syndrome. So it's just more common in older adults. And so that's when people fall asleep too early and then they wake up too early. So they're falling asleep at like 8 p.m. and then they're waking up at 3 or 4 in the morning. And they're like, but I want to go to bed at 10 and wake up at 6. So using melatonin at the right time can help push their sleep phase later. So melatonin supplementation can be helpful in those situations. But for the person who's kind of just, struggling with sleep, or they just want a little bit more support with sleep, less is more. Because I often see patients who are taking like 3, 5, 10, 20 milligrams of melatonin, which is way too much.
Yeah.
And that's, multiple fold times what the body produces. So I usually, when I recommend it to a patient, I usually use doses of like 300 micrograms or 500 micrograms. I rarely go above 1 milligram of melatonin. Timing is really important, because if you're taking it at the wrong time, it can throw your body clock off rhythm.
Yeah.
Yeah. And so, it's not something that I recommend for long-term use. There aren't a lot of studies looking at using it for more than about, 8 weeks. That's generally what most studies have looked at. So it depends on what you're using it for, is kind of the short answer there. And if you feel like you're struggling with body clock issues, then it's a good idea to talk to a doctor who understands this and knows how to use melatonin correctly.